So welcome. This is the September meeting of the Boston Region Metropolitan Planning Organization Transit Working Group. We last met in late July. These are bi-monthly meetings. We are now in September. So our notice of non-discrimination is that you are invited to participate in our transportation planning process, regardless of your race, color, national origin, including limited English proficiency, religion, creed, gender, ancestry, ethnicity, disability, age, sex, sexual orientation, gender identity or expression, veteran status, or background. Next slide. Our accessibility statement is that this meeting is accessible to people with disabilities. The Zoom products are compliant with exceptions with the following standards: Web Content Accessibility Guidelines 2.1, Level AA standards, and revised Section 508 standards. If you require any additional accommodations in order to participate fully in the meeting, or if you have any technical difficulties, please contact Lauren McGee, MPO staff at lmagee@ctps.org or 857-702-3706 if you would like to call, or via the chat box in Zoom. Our Zoom guidelines are that all participants will join the meeting with muted microphones. Please rename yourself to include your first name, your last name, and your affiliation. To participate in the discussion, please select the raise hand function. You can find this by clicking either on the participants button at the bottom of the screen, and a window will pop up with a raise hand button at the bottom, or the reactions button in the toolbar. And if you're on the phone, you can use *9 to raise your hand. Okay, so first things first, I think most of us are familiar faces. So in the interest of time, I think we can go without doing individual verbal introductions, but if everyone wants to just put in the chat who you are, what transit organization you're affiliated with, that would be great. Yes, okay, yeah, I wanted to make sure that everybody could type in the chat, and they can. Yeah, so just put your name, your transit organization, and that is what we will do in lieu of verbal introduction. My name is Abby. I am the policy analyst for the Boston Region MPO. So I run the Transit Working Group. This is a fairly informal meeting of transit providers from across the region and those who work in the transit industry writ large. They're also open to the public. They're open to anyone. And we meet to discuss transit-related topics, like any sort of relevant issues or challenges going on, and or resources for transit operators. So for today, if you could go to the next slide, Lauren. Today, we'll be having a presentation from Rachel Fichtenbaum, who is the manager of grant programs and mobility management at MassDOT. Specifically, the presentation will focus on the Community Transit Grant Program, which is through MassDOT, but she will also be talking about a few other grant programs that transit operators are eligible for. And with that, I will hand it over to Rachel to introduce herself and get started with her presentation.
Thanks so much for having me. Hi, everyone. I know we have a lot of experts in the room. Many of you have received grants from MassDOT in the past, so I would, we can just make this as conversational. I prepared a quick overview of the different grant programs that we have at MassDOT Rail and Transit, and then we have time for questions and discussion. Do you have my slides in your slide deck?
Yes.
Great. Great. Next slide, please. Okay. So I'm with MassDOT's Rail and Transit Division, which is the MassDOT's divided into different kind of modes. There's a big group that focuses on highways, a small group that focuses on aeronautics. We're the small group focused on rail and transit, primarily on sort of transit outside of the MBTA service area, but for our grant programs, it's the whole state. So we have a website, mass.gov/orgs/rail and transit division, and there's a section there, transit programs and services, and a lot of what you'll find there are our grant programs. So whenever you're kind of curious about what we have going on for grants, well, A, you can always reach out to me, but B, you can check out the website, and when we have a new grant program, we'll typically put a web page up and list it there. Next slide, please. So big picture of transit funding, what are the different pots of transit funding? So there's some funding that goes directly from the Federal Transit Administration to transit authorities. Urban systems in urban areas get what's called Section 5307 funding, and transit authorities in rural areas get Section 5311 funding. In Massachusetts, that all just goes right to the transit authorities. It's not available to other transit providers. Then at Mass.Rail and Transit, we have some grant programs that we run every year. So I've called those annual grants. And then sometimes we get funding in the state budget to run a separate grant program. Those can vary from one year to the next. So that's what I'm calling discretionary funding through the state budget. And then, of course, there's also other funding sources that aren't through MassDOT. Next slide, please. So our biggest annual grant program is the Community Transit Grant Program. The goal of that program is to expand mobility for older adults and people with disabilities. And it's really made up of two programs. One of them we just opened last week. That's where we actually give you funding. We give you dollars for operating and mobility management projects. And operating projects means you're actually providing rides. And I'll give some examples in a minute. Mobility management means you're doing something else that expands mobility for older adults and people with disabilities. You're not providing rides, but you're still helping older adults and people with disabilities enhance their mobility. The second part of the Community Transit Grant Program is where instead of giving you money, we give you a van. Fully accessible, wheelchair accessible vans. We pay about 80 or 85% of the cost, but we don't give you the money. We actually, if you get an award, you actually get the van. And that will be opening in mid-October, that application. Next slide, please. So some key points that are true about the Community Transit Grant Program, whether it's the mobility management and operating side of things or the vehicle side of the house, the overall goal is to expand mobility for older adults and people with disabilities. So you have to be able to connect your project back to that mission. It also needs to respond to a local need. And there's lots of different ways that you might identify or be aware of the need, but one of the ways that's required is you have to be able to reference something in your coordinated human service transportation plan. That's put together by the regional planning agencies. So CTPS does the one for the greater Boston area, and we have them all posted on our website. And it can either be, your project can either be specifically mentioned as part of the ecosystem of transportation in your region in that plan, or it can, in the section of kind of like, what are the needs, what are the unmet needs, your project can be addressing one of those unmet needs that's in the plan. We also are looking for projects that are building on existing resources, so not duplicating something that's already out there, but filling in gaps. And we strongly encourage coordination and collaboration to make the transportation resources go further. We have a website. We have a newsletter, tinyurl.com/CTGP news, but I don't just use it for the Community Transit Grant Program. I also highlight other grant programs there. So if you're not already on the newsletter, I would recommend subscribing. Next slide, please. And who's eligible? This is always an important question for grant programs. Nonprofits are eligible, government entities such as transit authorities, municipalities, councils on aging are eligible, and in some very specific cases, private taxi operators can also be eligible. Next slide, please. Okay, so examples. So I mentioned, I'll start with operating. So that's where you're providing a ride. So there's different ways to do that. One is by directly providing those rides. So you own and maintain the vehicles and you employ the drivers. So an example of that here is the Quabog Connector, which is a transportation service that was founded back in 2017 in the Ware area, which is kind of halfway between Worcester and Springfield, a pretty rural area. There were lots of community organizations working together on a number of different goals to try to increase anti-poverty and economic development in a relatively low-income rural area. And whether it was increasing education opportunities or job opportunities, they recognized that transportation was going to be an important piece of that. And this was an area with little to no public transit. So the town, in partnership with a community development corporation, founded their own transportation service that provides rides to older adults, people with disabilities, and others as well when space is available. The next picture is NEAT, which stands for Northern Essex Elder Transport. That's a nonprofit that runs volunteer driver programs on behalf of 13 or 14 councils on aging in Northeastern Mass, in the Merrimack Valley. So volunteer driver programs, that's another example. And then, yeah, I can put that in the chat, but when I'm done talking, because I'm really bad at doing two things at once. But it's tinyurl.com/CTGP news, like Community Transit Grant Program. MedWheels is a program run by a transit authority in Southeastern Mass, GATRA. And that is, yeah, thanks. They have a grant so that if someone needs long distance medical transportation from Southeastern Mass into Boston or somewhere else, and they can't get there, they don't qualify for Mass Health transportation, they can't get, it's too far for the sort of local council on aging service, et cetera, then GATRA will use their grant funds to purchase a cab ride or a similar type of ride to get that person to their medical appointment. So those are three different approaches to operating. Then mobility management, that's the other type of grants. And I said that's kind of anything else that isn't providing a ride. So here's some examples of what that can look like. Healthy Aging Martha's Vineyard is a age-friendly initiative on Martha's Vineyard, and they identified transportation as one of the needs to make the island a better place for older adults to live and have a good life. And so they got a grant to hire a mobility manager to work with older adults, but also to kind of work on developing programming and sort of figuring out, how to build on what's already there and expand options. So hiring a staff person to work on these issues. Then we have a picture of two people looking at a bus, a listing of buses. That is from the Pioneer Valley Transit Authority's travel training program. They got grant funds to hire a travel trainer to work with older adults and people with disabilities to help them learn how to ride the bus independently and safely. So that can be, a group trip. Maybe there's older adults who haven't ridden the bus for 50 years and just want to do it with someone a few times to feel comfortable. Or it could be intensive one-on-one working with someone with developmental disabilities to help them understand, learn sort of, okay, what are the landmarks? How do I know when it's time to get off the bus? What's a safe conversation to have with someone else on the bus? And what are things I shouldn't talk about on the bus? Whatever it is that someone needs to be able to ride. Then there's a picture of a grant that Brookline got to create videos to help older adults learn how to ride Lyft and Uber. And then the Tri-Town Connector is an initiative to, it's in Southern Berkshire County. They built on the Council on Aging Transportation that was serving a number of towns and purchased software to allow them to do on-demand rides so that in addition to scheduling in advance, people could also make a spontaneous trip. And they also opened their seats up to others who aren't seniors when there's available space. So those are some examples of Community Transit Grant Program grants. Next slide, please. A different annual grant program that we have is the Helping Hand mini grants. These are very small grants, $1,000 or less, and they have more of a rural focus. So I'm not going to spend very much time on that, but we can definitely come back to it if you have questions. Next slide, please. New grant this year, as some of you in the audience definitely know, we now have a TMA grant program, which is for Transportation Management Associations. This is the first year of a number of years. It opened for applications in May. We just announced the awards last week to the grantees and yesterday to the public. It's funded through the state bond bill, and it's funded at about $3 million a year up to 25 million total. And that's for TMA, a whole wide range of TMA projects overall to facilitate mode shift, reduce emissions, encourage more environmentally friendly commutes, and also expand mobility for employment type transportation. Next slide, please. Okay, so those are our annual grant programs. So now I'm going to shift to the grant programs that can come and go with the state budget. So thanks to the fair share funding or the millionaire's tax, we now have the education and transportation fund that comes through the state budget. That's a new pot of money dedicated to education and transportation. And so the past few years, we've had a bunch of new grant programs funded through that source. So both in the FY24 and this year in the FY25 budget, we got $4 million to expand the community transit grant program so that we can do more operating and mobility management grants and expand the scope so that in addition to focusing on older adults and people with disabilities, we can also fund projects that expand mobility for low-income individuals. This also comes with the advantage that when we use our typical federal funding source for the community transit grant program, we have to require local match, but the state funding we're allowed, we don't have to require local match. So we'll be able to get applications from organizations that, you know, maybe have a great idea, but don't have other funds to help with that. Last year in the state budget, we also had the Regional Transit Innovation Grant, which was $15 million for any transit provider for a whole bunch of things. That was a very big and competitive application process. We got 60 applications for a total of 48 million requested, and we had 15 million to give out, so we weren't able to fund everyone. This year, we did not get that grant program again in the state budget, but we did get a transit connectivity grant, which is for regional transit authorities. So only regional transit authorities are eligible. And it's for service that will connect routes or connect across service areas. So that was just due last week. So we're in the process of reviewing the applications that came in. Next slide, please. And then, you know, I'm focusing on the grant programs that MassDOT Rail and Transit oversees, but there's other funding sources, other grants out there. We have a webpage funding for community transportation on the mass.gov platform where we try to list some of those sources. Next slide, please. Great. So yeah, that's kind of the overview I wanted to share. I was hoping to save a lot of time for questions or discussion. So I would welcome, you know, any questions you have, but also many of you have experience getting grants from MassDOT or applying, or so I welcome your contributions as well.
Yeah, I have a question that you may have already answered, but in terms of the operations grants, are those like, I guess what I'm wondering is we get a lot of requests for pilot programs for small like community shuttles or smaller types of transit programs. And a lot of some of the issues that we've been running into is once our pilot funding runs out after 3 years, it's hard for communities to find like revenue sources to keep those going, even if they are successful. A lot of times it's hard to make the case at town meeting for X million dollars to help people get to medical appointments or things like that. So I was wondering, are these grants able to kind of fill that gap, or are these also for just like startup funds for beginning operations, and then it's up to the community or TMA to find like the long-term funding source?
We don't guarantee funding year after year, but we don't have a hard stop. So we don't say, you know, we'll only give you 1 year, we'll only give you 3 years. We do have a track record of providing ongoing funding to many projects, but it's not guaranteed at this point. It's an annual program, so programs do need to reapply.
Mm-hmm. Yeah, I'm wondering if any of the attendees, any of you have gotten any of these grants, sort of like what the process was like, any sticking points you had, anything like that.
feedback always welcome. We
Yeah.
can't fix all the problems immediately, but do work on sort of adjusting and improving over time.
Yes, Susan.
Oh, hi. Yeah, we did receive a grant, actually two now. So we appreciate that. We use it for our L'Express bus service, which is a public bus that has operated since 1979. It serves people of all ages and abilities. We do, of course, have heavy use by seniors, people with disabilities, and low-income people. And so we do appreciate the operating support. It's helped to ward off some further cuts to the program. We also received a mobility management grant that helped us with some marketing things. So we really do appreciate that. We had applied for vehicles one time. We weren't eligible for vehicles because for vehicles, that really has to be very specifically only for seniors and people with disabilities. And we're a service that wants to remain open to the public.
Yeah, we realized, unfortunately, a bit late in the process, sorry about that, Susan, that we couldn't do vehicles for fixed route service. So we are working on making that clearer for the vehicle round this year based on that experience. But we can, a program that gets a vehicle from us can, if they have extra space or, you know, outside of typical service hours, can open up to other groups. But with fixed route, even if you're primarily serving places that serve older adults and people with disabilities, our compliance team determined that it just wouldn't satisfy Federal Transit Administration rules, unfortunately.
Wig?
Yeah, this was terrific. Really appreciate it. I'm wondering, where would one look for funding of visionary transit concepts?
Do you mean like
Regional? Sorry, go ahead.
Like a planning study, like making a vision,
Yeah.
or do you mean like your idea is so creative that it doesn't fit in a box of an existing funding?
Well, I'm always interested in resurrecting what was the Phase 3 urban ring, and that was basically rail based. Could have been light rail or heavy rail. Probably would use the Grand Junction. But I think as Boston's economy moved over the last 4 decades or 5 decades from in Massachusetts from a manufacturing-based economy to what is here locally a research-based economy, the connections that would be needed to include everybody are very different from what they were before. And specifically right now, two of the largest research centers in the United States are Kendall Square and LMA. They're extraordinarily poorly connected, and they don't connect well to other parts of the region, especially the new immigrant EJ community that's basically Lower Mystic to Lynn. And an urban ring would fix that. It also could support a soccer stadium or whatever. So that kind of thing. Where would you look to get that resurrected and pushed along? I think we're totally up to speed on bus lanes and all of those. I think smaller locally implemented projects. I think that's a matter of project funding more than vision in many cases now, because we kind of have learned how to do that over the last 10 to 15 years. But anyway, that's
Yeah.
my question.
Thank you for the question. I don't have a great answer. I think part of that type of like visioning at MassDOT happens in the Office of Transportation Planning, which is one of the other departments of MassDOT. And I don't think they really run it as a grant program so much as like they identify studies and then they contract someone to do the study. I mean, they did just do Beyond Mobility, their long range transportation plan, and got a lot of
Yeah.
public input on that. And then the other is, I know Sandy was just here, but I think left. So the T, like what kind of sort of visioning and thinking the T is doing would be the second place I can think of. We can do through mobility management for the community transit grant program, we can do like planning studies, but they're much smaller, like they're focused on older adults and people with disabilities. It's
sure.
not like the big picture stuff.
Yeah,
you're
no, and
talking
that stuff
about.
is
Yeah.
super important. I used to go to those meetings, including with Judge King, and really got to appreciate it. And I, I went to 250 MPO meetings when I was trying to work on the Green Line, but I kind of have dropped out, so I'm a little bit out of date. So anyway, I don't want to take up more time, but I'd be super interested in working with anybody on kind of longer visionary stuff.
Yeah, I would also just add in, and I know Travis, you've had your hand up for a bit, but I would also just add that occasionally, and this may not be like the most fun way to go about it, but when I used to work for a state representative in the state house before I was with the MPO,
Yeah.
and we would very regularly get like constituents who wanted to talk about ideas like this,
Yeah.
and not often, but once in a while, there could be like an earmark for in the transportation bond bill,
Yeah.
say like an earmark for if the team wants, they can use this money for a planning study to do this.
Yeah.
And those types of ideas like did come from constituents pretty frequently. So if
Yeah,
you would,
that's a great suggestion.
Yeah.
I actually wrote the bond bill funding for the Green Line overnight after getting an email from Pat Jalen that I had to
Perfect.
get it in before start of business the next morning. But that's a
Mhm.
great suggestion too. Thank you.
Yeah. And Travis, I know you've had your hand up.
Yeah, I'll just add, I agree. Sandy Johnson would be, I think, a good resource to reach out as well. And it's too bad Sandy had to jump off this meeting. Rachel, I was just curious if you could talk about maybe a couple things. One is there a reporting requirement in terms of what the funding was used for and what are the lessons learned? And then is there a way to sort of see kind of like what are some of these emerging and best practices that others can learn from? I wonder if you could just touch on that in terms of like, what are we learning from the different things that are happening from previous projects, and how is it reporting?
Great question. So we require quarterly reporting. We have some suggested metrics, but we let programs tailor it to their program. It really depends on your goals and what you're trying to do, what metrics are going to make sense. And then we have some like metrics, and then we have some open-ended place for any stories or other more qualitative things that they want to share. And I hope to work over the next year to build out sort of what we're doing in terms of bringing all that information together and sharing it more. At this point, I would say it's informal. So like we are very, when during the application period or at any point, any organization that's interested in potentially applying for a grant, we welcome you to reach out. We will meet with you one-on-one. We'll brainstorm your idea with you or answer your questions about the application. And so that is an informal moment when we would say, oh, your idea is really similar to what one of our grantees is doing in the Berkshires. Let me connect you. So we do that sort of thing, but at this point, it's more informal and less kind of external and structured. And there's a question from Allison in the chat. How do we measure if the service is serving older adults, people with disabilities, and low-income individuals? So great question. So the Federal Transit Administration, for the federal funding we use, the requirement is that the service be designed to meet the specific transportation needs of older adults and people with disabilities. So it's primarily about explaining what those needs are and how your project will meet them. This year with the state funding, we're able to expand to also include low-income individuals. And so the way we're doing that is that either the lead applicant or a partner agency needs to be an organization whose mission is focused on serving low-income individuals in your area. We looked into doing a demographic approach, and it just varies, across the state. And you can have, there may be there's a community that overall the demographics are affluent, but there's a small group of low-income people who have a specific transportation need. So this is the way we're approaching it this year. So to apply for the Community Transit Grant Program for a project serving low-income individuals, either your organization, if your mission statement includes something about a focus on serving low-income individuals, then, you can apply. You'll just explain the need, how you know it's a need, and how you're going to meet that need. If you're not focused specifically on serving low-income individuals, but you're partnering with an organization that is, then we just need a letter of support from that organization that includes their mission statement and the role that they're playing in your initiative.
Awesome. Thanks, Rachel.
Thanks for the question.
I'm wondering, so for an example of a program for low income residents, could that or would that look like, I don't know, some sort of transit voucher? How would you create a program that serves only low income people, or primarily low income people, besides fixed route service to a low income area?
Yeah, I mean, it depends on what the need is. So if there's a housing authority and people who live at the housing authority can't get to the grocery store, right? Then you're and maybe this is a need that the housing authority is very aware of, but also the local community action agency is oh my goodness, for years we've been having to go to we've been in dire straits trying to figure out how to get groceries for the residents of this housing authority. Then that's the need it would be meeting. Or yeah, that's the idea. It's not a means testing of riders so much as a holistic understanding of the community and what the needs are. Did that answer your question?
Yes, that's sort of what I was wondering. Yeah, whether it would be means testing or whether it would just be generally we know that this will be good for a low income residential area, or if it was specifically targeting individual low income earners or residents.
Yeah, no, I mean, programs can decide for themselves how they're going to operate. So we wouldn't prohibit means testing, but it's not a requirement. The way that we're hoping to hone in on it is by having organizations where that's their core mission is serving low-income people, be either the lead applicant or a key partner.
Something else that I'm wondering, and of course, if anybody else has questions, this isn't for me, this is for all of you. So please jump in, raise your hands, do whatever. But I'm wondering if you had any advice for people who do have to go to their towns or their cities or whomever and sort of every year make the case for why they deserve to have a line item in whatever budget, whether that's even the state or the municipality. If there were any sort of particular metrics or particular arguments that you would advise can be persuasive. I guess what I'm getting at is what do you see in a grant application that makes something a really strong argument for why this is necessary or valid or worthy of putting money towards, that other people can then take to their own other funding sources that they have to sort of ask for yearly or biannually or whenever, and say no, look, we really are doing good. Please give us more money.
Yeah, I mean, for the first part of your question, right? What's compelling to other funders? I would turn that back around to the audience, because you all in the room have more experience than I do making that case to other funders in terms of things that we look for. We look for sort of how you know about the local need, right? There's lots of different ways. Sometimes there's different studies, but there's also oh my goodness, we get so many calls from people asking for this service and we have to say, no, we don't have it. organizations that are really embedded in their communities and know their communities well, collaboration and coordination, because it means, you know, there's less duplication happening. We're making the transportation resources that we have go further and help more people get more rides. We recently added unmet needs, like how many calls you get that you can't meet, like requests for, if you're operating a service, right, there'd be requests for rides that you can't fill, as one of our suggested metrics for the quarterly reports, in under the idea that that might help sort of make the case in the future if you need expanded funding. But I would definitely be interested in what other folks have found helpful. I guess a combination of some writer stories or qualitative stories about the value of the service to people's individual lives with numbers, because so much of community transportation is about the impact it has on people's lives. It's, you know, it's not that you did however many rides, but it's that those rides got people to jobs that they couldn't have had otherwise, or to medical appointments that they would have missed otherwise, or to, you know, time spent in community with friends and family that otherwise they would be isolated in their homes.
Yeah, Susan?
Hi, well, my comments are actually more for the transit working group members, as things maybe we can potentially talk about and work on in the future. So certainly appreciate Rachel and all these grant opportunities. I do know, though, that we always talk about this need for more and better transit, better connecting people, more coordination, and so forth. So a few thoughts. First, I'm just going to parse out one thing: medical rides. I think we should put pressure on our legislators at all levels to see if more health insurance companies can pay for that, especially now with so many mergers of medical facilities and closures. We're finding people have to travel pretty far and they go so many places. And that just seems like somehow we've got to put pressure, I think, because again, just given the distances people have to go, it seems like such an odd thing for municipalities to be seeking funds for. So that's one thing. Certainly, obviously, transit authorities, you know, anytime you have demand response or public service, you know, people will be, or public, I mean, fixed route, you have people going to medical appointments. But you know, when you need something beyond what currently exists, that's one thing I think we need to look into. The other thing is just more generally, someone mentioned having a visionary plan. We absolutely need that. I think, you know, with the long range plan for the MBTA and I guess the Boston MPO coming up, I think really focusing on that. How can we get better and more connected fixed route service? And then just a more general, well coordinated, hopefully pooled, shared demand responsive service, because so many people apply for various grants to run different little services because they see a need. And then once the service is in place, it's like, okay, well, then how do I coordinate with others? And that's really difficult. I think there needs to be a little bit more of a top-down push. And anytime you look at like the coordinated public transit human service transportation plan, really when you look at all the needs out there, and it's either people want fixed route service, more of it, better connections, or they need the more supportive service of like a door to door, curb to curb. And seniors and people with disabilities are not monolithic groups. You know, some seniors are still working, and they have no mobility challenges, but they just need to be able to get to work. Some seniors want the freedom of being able to hop on public transit. So do some people with disabilities. But you do have some people that can't use, say, more of a fixed route public service. That's a much smaller group. And hopefully with better public transit, we can fix that. And then, of course, there will always remain people that where it's not going to be doable to have fixed route service. So I think we need to look at them in kind of the same pot as people, you know, that might need that curb to curb, door to door because of a mobility issue. So hopefully I've made myself clear. I just think we need better planning and a little bit more top-down push towards really trying to achieve the things we've said in these coordinated plans for many years. Thank you.
Len.
Thank you. I mean, I've been quiet because I don't provide transit and I don't write grants to me, but I do want to support what Susan was saying. And I do agree that we do need to have a top-down approach. It was interesting that I think it was Jonathan Archer and his group at MassDOT OTP was looking at the gaps across the state. Well, actually, I guess looking at the network and as a result, then seeing the gaps that are there. It'd be nice to get an update on that at some point. But Rachel, I'm sorry. Yeah, Rachel, good to see you again. First off, and second, from what you've been doing, do you have a sense of the gaps? From what you're doing, or if you were, I would say like, okay, if we made you like the queen of the system, are there gaps that you're like, this is what I would fund and if I, had a lot of money, it could fill in gaps, not all of them, but maybe, the high priority ones. Do you have a sense of that from where you sit?
So I've been at MassDOT for 2 years, but before that, I pretended to work for MassDOT for 10 years. I worked at Health and Human Services on a little initiative called Mass Mobility that was about community transportation for older adults and people with disabilities. And I spent a lot of time going around the state, going to community meetings, meeting with organizations and listening. And so I feel like, my understanding and sense of the state and the needs is based on that listening that I did. So, I think I draw a lot on that experience in my current role. I think we always have a tension of, right, like if for a coordinated, comprehensive approach, right, top down makes sense. At the same time, we don't want sort of someone who's very separated from the needs on the ground making all the decisions. So like, what is the right balance between sort of the decentralized hearing from the ground approach that the discretionary grants are good at, and then a sort of more comprehensive, holistic approach where you might want to see top down. So that's like very much a question I think about a lot. I don't know if I answered your question.
It was good enough, so thank you. No, because I'm not sure if my question was really answerable. It was really, no, let me rephrase that. You did answer my question given your experience. So it wasn't the answer that I was hoping for. So let me just say that, but given your experience, I understand why you gave the answer that you gave and I expected and accept. I respected and I accepted. Thank you. Yeah.
Were you hoping for more of a yes,
Yeah, it's like, and here are the gaps I see, and this is what I would do if I like had a lot of money and was the one that was like being able to help coordinate things. I certainly appreciate the need, to have the input from the bottom. If it's a top-down approach, but to me, top-down doesn't exclude getting input from the bottom. It simply says, look, we have a disparate system because a lot of other states, they have a county system that does the coordination. We don't. So we have these 351 municipalities like working on their own. Some get together and coordinate. The MPO is hopefully helping the region coordinate. I certainly know it's making a big effort to do so. And so we kind of need that coordinating body, on top, that has some real insight, and authority with a small a, to make things happen. So yeah. So what I was hoping for is like, yes, and this is what I would do. So that's it. Thanks.
Yeah, something that I've kind of been thinking about the last few meetings we've talked about like obviously the gaps, the coordination, the duplicative services that are all serving similar things, like somebody from Reading and somebody from North Reading both taking like separate medical vans to the same hospital on the same day or something like that, when it could be one van. And I've been wondering, like, one, if it would be useful, and two, if it would be like possible for us to do some sort of, with the transit working group, for us to do some sort of like mapping exercise in terms of like mapping out service areas and routes. I am not skilled with mapping software. I could not make it pretty. I could not make it like beautiful, but even just some sort of like scribbling over a map of Massachusetts of just like Lexpress routes in purple and then like Gatra service in green or something like that. I don't know if that already exists. I don't know if it's like hidden in the annals of like a directory inside of mass.gov's website. That's what I wasn't sure, Susan, to reference. She said, wasn't Jonathan Church of MassDOT doing that
Yeah.
map all fixed route? Yeah. And I wasn't sure if that was what you were referring to before, Susan, if that had come to fruition or not.
Oh,
It's still-
maybe
still
we
in
can invite
process.
him. Sorry.
No, go ahead, Susan.
Oh, sorry. Maybe we could invite Jonathan back because I don't know that he had a deadline. I know at one point when he came and met with this transit working group and talked about this project, I was so excited about this. And I know he had an intern or interns working with him, but then they might have turned over. But I wonder if it's time to maybe bring him back and see, get an update on this project.
I would at least reach out to him about timing. I think that he has a new intern who's like got it started moving forward again now. So he might, have a sense of when he would be a good time to re-update. But yeah, that is, I believe, the goal of that project.
Well, whatever he's doing will probably be significantly more valuable and beautiful than anything I could create in the whiteboard function of Zoom. Wig?
Yeah, I think it'd be hard to compete with Jonathan, but this might be an interesting question for some of the AI academics. It would be super applied to have some of the research universities or others, really interested in this stuff, think about whether they could come up with more efficient algorithms that could then maybe interface with the real world. We hear about AI and it's all kind of global or interstellar home runs, but maybe there's some uses for it at this kind of more practical level. And we sure have a lot of academics here. Also might be interesting to ask Tim Reardon. He's kind of independent now, but looks to me like he's got the biggest data set in Eastern Massachusetts.
Yeah, that's a good point. I didn't think of that, but yeah, that's a good point. I'm sure that if there's not already a consulting firm working on that there probably will be soon.
Yeah, and it could just, some grad students or some smart undergrads, you never know.
Mm-hmm. Are there any more questions, comments, anything that anybody wants to discuss? All right. I think you can move on, Lauren. I think the only 2 slides left are like members items and closing out. Yeah, so discussion, we just discussed, we're good. And then, yeah, so members items, just are there any updates on municipal projects, any grant awards or applications? That's sort of what we've been talking about this whole time. So I'm assuming there's nothing new. Or events coming up that you want people to know about, new programs that you've started, anything of that sort. Yes.
One other tiny thing, sorry to talk so much. I haven't flown for myself for 25 or 30 years, but I have to go to conferences in different places and just came back from International Environmental Epidemiology Conference in Santiago, Chile. And I was stunned at the effectiveness of their transit and ground transportation system, including walking and biking. And it got me thinking that I think there are about 3 million people, but I could be off. And it's all one system, probably implemented uniformly fairly recently, after some turbulent history. But the benefits of it being the same wherever I was, like all the walk signals were the same, the street markings were the same. Len mentioned all the cities and towns here, but it just occurred to me that having a really visible, understandable system by all may have some pretty big advantages over each municipality implementing its own thoughts and subtleties.
Yeah, no, I think you're right. I think that even little things like coordinating logos, like having branding be similar, can just signal to people like, oh, that's a bus. I know that's something that I've heard from people before, is like, I just didn't like, yeah, I see that vehicle go by my house like almost every single day, but I had no idea that like the town even owned it, or I had no idea that that was like a service that existed. So yeah, I think you're right that those like visual cues even can be pretty powerful in ways that we don't always expect them to be, especially when like you're someone who thinks about transportation all the time, like a lot of the people on this call. You don't really think that like what it says on the side of the van matters that much, but it does, or else people won't know it's there. All right, well, we are coming up on time. So our next meeting will be in mid to late November, ideally mid-November, because of course, like I don't want to schedule it during Thanksgiving week. A lot of people aren't working, a lot of people aren't available. So I will try to find a time in like early to mid-November. So it might be a little bit shorter than the normal like 8 to 9 weeks between meetings. And I am hoping to have a person from Transit Matters to discuss their pulse scheduling report. That has to be like firmed up, but that's ideally what our next meeting will be about. The recording from this meeting will be on YouTube. Lauren, our star assistant planner, will be in charge of that. If anybody wants to reference this, I will send out the slides after this, and any like pertinent notes or anything from that in like the body of the email that I send out to follow up. But otherwise, if there are no other questions, everybody have a wonderful Thursday, and I will see you in 7-ish weeks.